Let's talk about the Forever Young lens. The Forever Young lens is designed to allow you to do most activities without glasses. Specifically, we're looking at correction of your far vision, allowing you to see things for driving, movies, watching television, correction of your intermediate vision, things like viewing a dashboard of your car or seeing a computer monitor, and reading vision, things like looking at your cell phone, reading price tags, seeing newspaper print or books and other things. Most patients then are able to do the vast majority of their activities without glasses. There are some limitations to what this lens can do, and there are still times you will need glasses. Things like very small print. The lens does not correct for very small print. So very small print, like reading a medication label, usually patients will need a part-time reading glasses over the counter at low power. Low lighting. Low lighting is one of the other limitations of the lens. In lower lit conditions, extra light will be necessary for good reading. Patients will generally find needing to use additional light. And then you may need to slightly adjust where you work or hold things for the lens to come into best focus. The one limitation of the lens is that there will be some rings or halos around lights. This comes from the design of the lens. The lens works by having a series of rings in it, and that's what allows the focus at multiple distances. However, patients will see rings or halos around lights, mostly at night, such as when driving with oncoming headlights. Most of the time, these are noticeable for 1 to 3 months, maybe even annoying during this time. Then they usually go to a low level that most patients are not bothered by after the 1 to 3 months. However, the rings around lights do tend to be a permanent, though mild, side effect. The surgery itself is a procedure done in an operating room-based setting. Our operating room is about a mile from our office. During surgery, patients are under a twilight-like anesthesia. They won't really remember too much of what's happening during the surgery. The surgeon will use a laser to enter the eye, remove the lens, which is where most people eventually get cataracts, and replace it with this Forever Young lens. The good news about the lens is it's a one-time procedure to replace the lens, and that lens is permanent. It also then eliminates the need for future cataract surgery. Patients will follow up in the office the next day. The vast majority of patients will have some swelling. Vision usually is fair, but we generally advise about 3 to 5 days of downtime for patients to recover before they plan to resume most normal activities like work or driving. Other things that will need to be avoided are 2 weeks of no heavy lifting, no lifting anything heavier than 25 pounds, and 2 weeks of no bending past your waist. So patients will need to take some precautions during this time. Eye drops are necessary for 1 week prior to surgery and for 4 weeks after surgery, and patients will get written directions for those. We will generally then follow up at about 2 weeks and 2 months later to ensure everything is healing appropriately. There are some side effects of any surgery. The number one side effect of this surgery is dry eye. Dry eye does tend to be a temporary side effect that lasts for 3 to 6 months during the recovery time. During this time, patients will need over-the-counter eye drops like artificial tears to help them. Also, we do offer some options and treatments to help prepare the eyes for the surgery. We call this the ocular surface package. It specifically has 2 purposes. It reduces the rate of dry eye that occurs after surgery, and then it also prepares the eye for inside of the eye surgery by removing any excess bacteria and other things, cleaning the eyes, helping it to reduce the chance of any issues that could arise. This procedure is done in the office prior to the surgery. It's a 2-step process. Step 1 is a gentle cleaning of the eyelids and eyelashes to remove any excess bacteria or buildup that can develop there. It's a gentle, fast procedure taking about 15 minutes. Step 2 is a warming and massage of the glands in the eyelids called the meibomian glands. These glands produce the oil that flows onto the tears, helping keep our eyes hydrated. By helping these glands produce healthier oil over time, the rate of dry eye is reduced. The benefits of this procedure have been shown to potentially last for several years. The second side effect is some blurred vision in the recovery period. Like we discussed, it is normal that patients will need to take generally 3 to 5 days where it's pretty easy prior to resuming most normal activities. We may need multiple steps to achieve the best results after this surgery, so patients do need to be prepared for this. Step 1 is the implantation of the lens, like we described prior. Step 2, the lens, which is put in crystal clear, could develop a clouding or film to it. This occurs from the structure it's placed inside, and it's kind of like a scar tissue process. Just like some people scar on their skin after having a cut, others don't. This same process may happen, and it can affect the vision. If it does happen, about 50% of patients require a minor in-office laser procedure to clean the lens called a YAG capsulotomy. This can be done 3 months or more after the original surgery. Finally, our hope is that patients will achieve a good level of vision at multiple distances, seeing all far away things without glasses, the vast majority of things at intermediate and close, only needing glasses for small print or low light. Most patients do achieve this. Some patients will need additional surgery, however, to get to this goal. This additional surgery is generally LASIK or a similar procedure like PRK to reshape the surface of the eye after. This can essentially allow us to fine focus your vision and adjust it if necessary. Finally, there are some risks of surgery that are very rare, but by entering the eye do include a very small chance of infection or a very small chance of a retina problem called a retina detachment. These are uncommon, generally occurring less than 1 in 500. Should they occur, additional treatments are necessary, usually are very successful. Very rarely there could be some loss of vision in the affected eye, though once again the likelihood of this is very low, and if they do occur, treatment is almost always successful. In summary, the Forever Young lens is a very exciting surgery that allows vision correction at multiple distances. It is important to note that there are sometimes reading glasses will be necessary for small print or low light, and that multiple steps may be required. However, this surgery is very successful. Some of our happiest patients are those that choose to have this procedure done. Another option for vision correction with surgery is 3D LASIK. With 3D LASIK, we can use the approach called monovision. With this, one eye is adjusted for distance vision and the other eye is adjusted for near vision. This has the advantage of a lower cost investment and a less involved process. The disadvantages are that cataracts can still form, meaning in the future additional surgery may be needed. Most people develop cataracts sometime in the 60s and 70s. Also, because one eye is adjusted for far and one eye is adjusted for near, there is generally a little bit less depth perception. Alternatively, like we just discussed, the 3D Forever Young lens surgery is a good option for many patients. The lens implant provides distance, intermediate, and near vision in both eyes. This results in best depth perception. It does last longer since the lens replacement is permanent and you won't need to have cataract surgery. The disadvantages are there is a higher cost investment involved, and in general, the process of surgery is more involved. Either surgery is a good option. It is a matter of personal preference which option may be best for you. Let's talk about laser vision correction options, specifically LASIK. Watching patients' lives transformed by LASIK is one of the favorite parts of my job. I'm happy that you're considering having it done. LASIK is performed just down the hall in our operating room. It's a fast procedure taking no more than 20 minutes. Prior to surgery, patients can take a mild sedative to help them relax, and it's all done with eye drops that numb the eye so it's completely pain-free. Throughout the procedure, patients lie flat on their back on the surgery bed. For the first step in the process, our surgeon uses a laser to create what's called a flap. We use all laser technology here, so the surgery is done with a laser from start to finish. After the flap is created, the surgeon will lift the flap and use a separate laser to apply a corrective treatment. During this treatment, you will hear a buzzing noise and you may smell a faint burning smell. Both of these are normal. After the treatment, the surgeon will place the flap back down and you'll be done. Even immediately after surgery, patients will see improvement in vision. On the day of surgery, however, the vision will fluctuate quite a bit. The eyes will likely be red, they may sting a little bit. You will need someone to drive you home from the surgery. The next day, the vision should be about 80 to 90% recovered. Most patients then are safe to resume most normal activities like work or driving the next day. Eye drops are used for 1 week. These are 3 medicated eye drops and they help the eye to heal up in the most healthy and precise manner. You'll get written directions for these. There are some things you'll need to avoid after the surgery. For 3 days, it's very important not to rub the eyes. We'll provide you some eye protection to wear when you're sleeping. It's also very important not to get any water in the eyes. We'll provide you some goggles to wear when you're showering. For 1 week, you can't use any eye makeup. And for 2 weeks, you'll need to avoid swimming pools, hot tubs, and tanning beds. You'll get written directions for these instructions, and someone will go over it with you again the day of your procedure. LASIK is a very safe procedure with long-lasting vision correction results. However, like any surgery, there are some side effects. The number 1 side effect associated with LASIK is dry eye. The eyes do tend to be dry for 3 to 6 months after surgery. We recommend several things to help reduce dry eye after surgery. The use of over-the-counter teardrops are recommended frequently in the first several weeks and reducing use as you get further out from the surgery. Others are in-office procedures that we recommend prior to the surgery. We call this the ocular surface package. It's a 2-step process. Step 1 is using an instrument to gently clean the eyelids and eyelashes. This procedure removes any excess bacteria buildup that can grow along the eyelashes, which helps your eyes to produce naturally healthier tears over time. It's a fast and comfortable procedure taking about 15 minutes. The second step is a warming and massage of the glands in the eyelids with an automated device. These glands line the eyelids and are called the meibomian glands. By warming these glands, they produce higher quality oil. The oil then flows onto the surface of the eye, producing naturally or healthier tears. The effects of this treatment can last for several years after it's performed. After your LASIK procedure, the surgeon can also place a blocker in the duct that the tears drain out the eye through. This duct is a small hole called the punctum. By placing a plug here, this will help keep more of your own body's moisture on the surface of the eye. The plugs we use are temporary, they last for 3 months, and they slowly absorb over time. They help to promote the best comfort as well as vision clarity in the months after the procedure. The second side effect of LASIK is glare and halo around lights. People do tend to notice these for 1 to 3 months. After that, most of the time they do go away completely. There is a small chance of issues that could arise related to the flap. These are uncommon, occurring about 1 in 100 in our office. This could be things such as inflammation or swelling associated with the surgery. Some cells could grow from outside the flap where they belong to underneath the flap where they don't belong, or rarely there could be a wrinkle associated with the flap. If any of these were to occur, additional eye drops might be necessary, and in some rare circumstances we might need to perform a separate procedure in the office to make some adjustments. Finally, our hope with the surgery is you'll have one surgery, you'll see very clearly, and the results will last a long time. Most patients have this experience. However, there are some things that could interfere with that. The first of these occurs in the short term, and it's what we call underhealing. Underhealing means you don't quite heal as anticipated and your vision doesn't reach the clearest level. Should that occur and you've healed with some prescription, we may need to perform a second procedure called an enhancement to adjust for this. This can be done several months after the initial surgery. There's also something called regression. Regression is a long-term change or drift over time, meaning that patients will see well initially after surgery, but then months to years later, this drift or shift occurs. Should this occur, another procedure called an enhancement can be done to adjust for vision. Finally, there are considerations for those over the age of 40. At the age of 40, there's a process called presbyopia that starts. Patients will then need some form of vision correction for reading up close. If LASIK is done to correct for distance, patients will need to wear reading glasses for looking at close activities. There is another option called monovision, in which one eye is corrected for far and one eye is corrected for close, which would reduce the need for reading glasses. It is important to note that surgery does not create this problem or issue. For patients over the age of 40, you would have to deal with this in another way if you don't have LASIK, such as using bifocal glasses or bifocal contact lenses. Ultimately, LASIK is a very safe and successful surgery that has a long-standing history behind it.